Hello, my name is Deanna Radford. I'm a nursing student in the baccalaureate program at Bluefield State College. This presentation is on the 7 warning signs of cancer. Cancer claims more than 1,600 lives a day in the United States. This is projected to double by the year 2030. We as healthcare providers have an obligation to assist in bringing this disease under control. To help save more lives, the key is to reduce cancer incidences, to decrease the mortality from cancer, and improve quality of life. Cancer tops the list of Americans' health concerns because it is still prevalent and too often deadly. Early detection is prevention. The sooner cancer is found, the better. Better screening assists the doctors in finding cancer at its earliest stage. This increases the chance of a cure. So remember the word caution as we relate this to the 7 signs of cancer. C stands for a change in bowel or bladder habits. This may be a sign of colon or bladder cancer. Colon cancer is the 3rd most common form of cancer in the United States. With the advances in early detection and treatment, colon cancer is one of the most curable forms of the disease. Polyps are associated with increased risk of colon cancer. Almost all colon cancer begins as a polyp. Removal of the polyp can prevent the development of cancer. This can be removed painlessly during a colonoscopy. Doctors recommend routine colonoscopy screenings every 10 years starting at the age 50. Currently, less than 6 out of 10 United States adults get this recommended screening. A is a sore that does not heal. This may be a sign of many types of cancer. Skin cancer may bleed and look like a sore that doesn't heal. A long-lasting sore in the mouth could be a sign of oral cancer. U, unusual bleeding or discharge. Any signs of bleeding needs to be followed up with your doctor. Coughing up blood may be a sign of lung cancer. Blood in the stool may be a sign of colon cancer. Blood in the urine may be a sign of bladder or kidney cancer. Cancer of the cervix and uterus may cause vaginal bleeding. A pap smear is the main test for the cervical cancer and one of the most useful screening efforts of the modern medicine. Women aged 21 and older need one every 3 years. T, thickening or lump in the breast or other body parts. Some cancer may be felt through the skin, often occurring in the breast, testicles, and lymph nodes, and soft tissue of the body. A lump can be an early or late sign of cancer. Breast cancer ranks 2nd as the cause of death in women. The main test for breast cancer is a high-quality mammogram, yearly starting at age 40. Treatment is much more successful if detected early. I, indigestion or trouble swallowing that does not go away. This could be signs of esophageal, stomach, or throat cancer. O, obvious changes in a wart or mole. Any skin changes in color, shape, or size needs checked out. A good example of the importance of finding cancer early is melanoma skin cancer. It can be easily removed if it has not grown deep into the skin. The 5-year survival rate at this early stage is 98%. But once melanoma has spread to other parts, the 5-year survival rate drops to about 16%. This is a huge decline. N, a nagging cough or hoarseness are signs of lung or throat cancer. Lung cancer is the 2nd most common cancer in the United States, by far the leading cause of cancer death. This cancer is the most preventable because most cancers are linked to smoking, secondhand smoke, or exposure to environmental factors. Lung cancer are usually caught late and are very hard to cure. Doctors have found tests that can be used to screen for patients at a high risk. I'm going to elaborate more on the 7 warning signs of cancer. Remember, caution, and how early prevention can save lives. Spotting the first signs is stopping cancer before it starts. 50% of all cancer can be prevented by promoting early screening and life-saving changes. Cancer is a disease that can cause almost any sign and symptom depending on its location, how big it is, and how it affects the area surrounding it. Treatment works best with cancer if cancer is found early. The American Cancer Society have guidelines for early detection, like the 7 warning signs of cancer, which is caution. Since 1991, there has been a 23% decline in the death rate of cancer. That is about 1.7 million lives saved. Increasing cancer awareness with early detection and screening protocols have made a huge difference in the disease of cancer. We can treat the precancer before it has a chance to become cancer. So remember caution when observing the 7 warning signs of cancer. I'm going to close with a thought for the day, that the saddest aspect of life right now is that science gathers knowledge faster than society gathers wisdom. So we, as healthcare professionals, have an obligation to promote early prevention to improve our patients' quality of life. Thank you.